Let us now go to abnormal metabolism of body fluids. The topic is insufficiency, impeded distribution, and excretion. Abnormalities of fluid metabolism, whether regional or systemic, can disturb the production, distribution, and excretion of fluids. The main pathological effects are insufficiency of fluids, maldistribution, and retention. The complex process of fluid metabolism require the transforming, ascending, descending, and exiting, entering actions of qi. Only when the transforming actions of qi are vigorous can the production and excretion of fluids be normal. Only when the ascending, descending, and exiting, entering actions of qi are normal can fluids flow, rise, and sink harmoniously, and their absorption and excretion remain balanced. They also require the harmonious participation of many visceral organs, including the lung, the spleen, the kidney, the liver, the sanjiao, and the bladder. The lungs' dispersing actions and the kidneys' transforming actions are especially important. When the body fluids are insufficient quantitatively, the viscera, the exterior, the orifices all lose their moisture and nourishment. There are two groups of causes. One is damaged by the dryness and the heat pathogenic evils. The other is loss due to profuse sweating, massive blood loss, vomiting or diarrhea, polyuria, or excessive use of drying and warming herbs. Insufficiency of fluids can produce such symptoms as dry throat, chapped lips, thirst, dehydrated skin, and withered hair. In more severe cases, there may be sunken eyes, reduced or absent sweating, oliguria, and constipation. Though the two aspects of distribution and excretion are quite different, their abnormal functioning can induce retention of fluids and formation of phlegm. The transformation of fluids into sweat depends mainly upon the depuration function of the lung. The transformation of fluids into urine for excretion depends mainly upon the transforming action of kidney qi. Hence, disturbances of lung and kidney functions can all lead to retention of fluid within the body, sometimes suffused in the skin to produce edema and sometimes among the organs. In general, impedance of the distribution and excretion of fluids most often lead to blockage by viscid dampness, retention of fluids, or accumulation of phlegm and rheum. Blockage by viscid dampness. This is due principally to the loss of the transporting and transforming functions of the spleen, so that the distribution of fluids is impeded. The retained fluid accumulates and turns viscid. In this form, it easily blocks the movement of qi. This is manifested clinically as chest tightness, nausea, abdominal distension, heaviness in the head and body, stickiness in the mouth without thirst, diarrhea with loose feces, a yellowish face, and edema. Fluid retention. This usually occurs when the functions of the lung, the spleen, and the stomach are compromised. If fluid is not transformed, it remains in the body. If it stays in the skin, it appears as edema. Regionally in the head, face, eyelids, the limbs, the abdomen, or the back, or generalized. If it accumulates in the abdominal cavity, it appears as ascites, causing abdominal distension. Accumulation and phlegm and rheum. Both phlegm and rheum result from impairment of visceral functions, hence impedance of fluid metabolism. As a result, the fluids do not transform normally but accumulate as rheum. Gelling turns rheum into phlegm. This can cause a variety of symptoms. When rheum causes illness, it has different names depending on where it accumulates. Rheum in the chest is known as suspended rheum, in the lung as sustained rheum, and in the limbs as overflowing rheum. Phlegm ascends or descends with qi and can reach every place in the body. It can affect different organs and meridians to produce a variety of illnesses and symptoms. For example, phlegm in the lung can cause coughing that is productive of sputum. Phlegm in the heart can cause chest tightness, palpitation of the heart, mental confusion, and delirium. Phlegm in the stomach can cause nausea, vomiting, and discomfort in the epigastrium and abdomen. Phlegm in the meridians, sinews, and bones can cause scrofula, subcutaneous nodules, numbness in the limbs, and sometimes hemiplegia or carbuncles. Phlegm in the head and eyes cause obscuration of the orifices with dizziness or syncope. Phlegm in the throat can cause globius hystericus. Thank you so much for your attention.